Hello, this presentation is to introduce you to art therapy for children and young people. However, the information provided is also very relevant for all ages. My name is Sarah Swindlehurst and I am an art psychotherapist, cognitive behavioural therapist and hypnotherapist. I have been working also as a yoga teacher, trainer and therapist since 2005, which I've been accredited with Yoga Alliance Professionals and the International Association of Yoga Therapists. I specialise in mental health and in particular trauma, which I have had extensive training in and experience of working in. Now, although this presentation is about art psychotherapy, in my work I sometimes combine the modalities that I have been trained in, depending upon a client's needs. For example, I might advise a client on practicing breathing techniques or relaxations, and or I might use cognitive behavioral techniques and combine these with art therapy. Um, However, the art therapy techniques can be directive or non-directive, which means I may direct the client in a particular technique or theme, or suggest to the client that they choose for themselves. So the aims of this presentation is to clarify what art therapy is and how it would benefit a person, how it is different to an art class. I will be clarifying and providing you with information regarding how art therapy is a helpful therapeutic intervention and discuss who can be referred whilst covering aspects of confidentiality. I shall also provide insight into the mechanisms of the therapeutic relationship, including verbal and non-verbal communication processes. I'll also cover assessment and the reporting of the therapy progress, and also how collaborative working may happen within a referral or service. The reasons for collaborative working will also be reviewed, and I shall mention how to refer to art therapy and the services offered. So for a moment, just reflect for yourselves on what you would think art therapy is. As the British Association of Art Therapists states, the use of art therapy is a form of psychotherapy that uses art media as its primary mode of expression and communication. Therefore, art is used as a medium for a client to express, process, and integrate their emotions and feelings within a safe, secure environment. It can help psychological, emotional, and developmental well-being, as well as helping to improve confidence, self-esteem, resilience, and self-awareness. It is accessible for any age, gender, or ability, and can be offered to individuals or as group work. Generally, art therapy sessions use a range of art materials such as clay, paint, papers, card, sand, pencils, cloth materials, or natural materials. Art utensils may also be used, such as paintbrushes, but some clients might also use their hands or body parts with the art materials to create the artwork. So how is art therapy different to an art class? Art therapy is facilitated by a qualified art therapist who has completed a recognised master's qualification. They are also registered with the governmental body Health and Care Professions Council. This is designed to protect the interests of the public when seeing a health practitioner. The art therapist may also be registered with the British Association of Art Therapists. Art therapy involves a therapeutic relationship rather than a teacher-student relationship, and this takes place in a confidential, safe place rather than in a class. The art therapy goal is to use art to express feelings and emotions, whereas an art class is about learning how to draw or paint in a certain way. There is no right or wrong way to use materials in art therapy, whereas in an art class, certain techniques are likely to be recommended. Artwork in art therapy is reflected on as a method of communication. In an art class, the art is usually evaluated for its formal qualities and based upon the principles and elements of design. The reason someone is referred to art therapy may vary. Some of the reasons may be when parents are going through divorce or separation and there are signs of changes in behaviour and distress. It could be following the death of a family member or friend, or when there is knowledge or suspicion of some kind of abuse or domestic violence. When a child or young person is new to the school, area or country and is having difficulty settling in or integrating. When a person is angry, erratic or shows mood swings or signs of possible depression. When there are identity issues, for example gender or cultural. If there are health or disability issues such as life-limiting illnesses for the child, young person or a family member. Or when a child or young person refuses to engage with specialist services but is willing to engage with an alternative provision. Preferably, the art therapy usually takes place on the same day and time each week. Ideally, the room that is used for art therapy is the same each week, as this will provide a sense of security for the client, and it can be anxiety reducing if there is room continuity. The art therapy session is confidential and private, and this includes any artwork that is made. The artwork usually is kept securely after each session in a locked storage container or office. For the therapeutic relationship, it is important that the client also understands that the sessions are confidential and that they can discuss and explore their issues safely without worrying that it is going to be talked about outside of the therapy. Obviously, if there are any concerns regarding the client's welfare and safety arising, then this will be raised with the appropriate professional designated safeguarding lead. If working within a multidisciplinary team, an art therapist will partake in scheduled review meetings and provide reports as and when required. The sharing of information regarding the art therapy will reflect client confidentiality. However, other aspects such as the level of engagement and progress will be noted. The client-patient informed consent will be required prior to the art therapy intervention. Parental consent for a child or adolescent to partake in the art therapy is required prior to therapy start, and a meeting with the parent would be pertinent if possible, so that they can hopefully be fully informed as to the nature of the art therapy sessions. Confidentiality and how the sessions will run will certainly be discussed with any age client, so that they can feel informed and safe to partake in them. Art therapy can be a valuable tool in the recovery process of individuals. It can be introduced as an alternate coping skill, where clients are encouraged to creatively express difficult and overwhelming feelings and emotions that are otherwise expressed through negative behaviours. Art therapy gives form to feelings, concerns and stress which can be understood and addressed. Here are some of the benefits of art therapy. The process of working with materials such as paint, oil, pastels, clay and fabrics and creating a final product has amazing healing properties that will help children and young people or people of any age. Some of the benefits are that they can explore their emotions and strengthen their sense of self. They can manage stress, work through their problems, learn better coping skills, and uncover different aspects of their personalities. Art therapy can even boost self-esteem. Using different techniques, individuals are guided to find shapes, colours and words that describe problems that perhaps are unknown or unconscious to them. Once these shapes are formed, open dialogue and reflecting on these artworks are encouraged so that new insights into their issues can be gained. As mentioned, art therapy is a form of psychotherapy in which there is an art therapist and client in a therapeutic relationship. However, within this therapeutic relationship, the use of art media is the primary mode of expression and communication. This creates a triangular relationship between therapist, client and artwork, and so communications can fluctuate between each throughout the session. It has been noted that a good therapeutic alliance in psychotherapy is the best predictor of outcome. It has also been researched that insecure attachment is a risk factor in mental health challenges such as anxiety, stress and depression, but also in maladaptive behaviours such as self-harm, eating disorders and bullying, etc. The attachment theory lends itself well to the therapeutic alliance, as the art therapist can metaphorically represent an attachment figure where the client feels safe enough to express their emotions and feelings. Furthermore, the room in which the art therapy takes place and the art therapist can be considered a secure basis from which the client can safely explore, express, revisit, reframe and take risks. Exploring attachment representations within the art therapy session may also be useful in providing both therapist and client with insight into the client's internal working models and their thoughts, feelings and behaviours. For example, a client who has received inconsistent care and attunement from certain others are likely to have a more difficult, coherent sense of self, as well as external realities. This incoherence shows itself in mental health challenges. Environmental perceptions developed by the client will guide their expectations of self and others, arising from various internal, external, conscious and unconscious sources. Art therapy allows exploration of the client's internal and external expectations. The artwork is created outside of themselves at a safe emotional distance. This is particularly important when it comes to those that have experienced trauma. For a client that has had attachment disruptions and/or for a client that has suffered trauma, their ability to mentalize, organize and express personal states can be impaired, and this will reflect in their mental health and/or behaviour states. They may find it difficult to speak to a professional and can be vulnerable to stigma and shame. However, through art making, this encourages the client to engage in imaginative and symbolic expression rather than just verbally, as well as reflection on the art made. They can also reflect on themselves and/or others, and thus this can foster mentalization. With the support of an art therapist, this reflection and mentalization can help the client integrate their inner and outer conflicts. Clients may show their difficulties via behaviours. The addition of art making and the process of the art making in the therapeutic relationship further allows the client to communicate feelings that are difficult for them to put into words. A client may find it easier to show the art therapist how they feel rather than to talk about it, especially if they have difficulty in understanding what it is or what is causing them to feel or behave the way they are. Creating artwork allows the client a safe emotional distance from their feelings so they can explore their problems and learn to manage difficult emotions in relation to these. So when it comes to an art therapy session, the sessions can be seen as verbal and non-verbal, in that communication to the art therapist can be through talking or through non-verbal ways. As we saw from the previous video, the note of the young girl who didn't speak to anybody but could communicate through their artwork was an important way of her letting out what was going on internally, which she couldn't necessarily verbalize. Through actively listening to the client, the art therapist will not only listen to the words being spoken, if they're speaking, but will be aware of any reoccurring words, themes or metaphors that the client talks about or says. An art therapist will be noting any consistencies to the verbal communications as well as any inconsistencies, such as swapping between happy themes or sad themes. Themes and metaphors may also appear within the client's artwork. For example, certain people, animals, foods may feature in most of their drawings, or they may use containers, which tend to be the focus of a client's artwork if they are using these containers metaphorically to contain emotions and feelings. An art therapist is actively aware of any observations such as these, but also of the client's body language and demeanour. For example, They will notice whether a client moves slowly or expressively, or if they are restless and move from one art material to another. Which material the client uses and how they react to different materials may communicate to the art therapist a stage of their development, or it gives insight into their defences. All aspects of the art therapy session are noted as potential communications, as are the similarities and differences running from one week to another. So talking a little deeper about communication and how this works implicitly, unconsciously, and explicitly, consciously. Implicit memory is generally unconscious, bypassing language and consciousness. It is associated with the right brain hemisphere. It has also been noted that developmentally, the left-thinking explicit brain is not receptive until late into a child's second year of life, and so early attachment experiences are reflected and stored in the implicit, unconscious right brain structures. Additionally of interest is that developmental trauma, PTSD, and traumatic memory are more easily recorded in implicit unconscious memory, regardless of age. This mechanism initially serves to protect a person from becoming overwhelmed and unable to function. However, this implicit unconscious memory is, if it is not linked to explicit conscious verbal memory, then this can become troublesome for a person. This can then create unconscious behavioural issues and mental illnesses such as trauma, PTSD, and eating disorders. If left without any intervention, the missing integration of implicit and explicit memory may therefore create disruptions in a person's development, self-regulation, and human interactions, and it is likely to be perpetuated throughout a person's lifespan. Art making offers a way of expressing non-verbal or traumatic memories because the process of art making uses the same part of the brain that has stored these unconscious memories. Memories as such can therefore be accessed and expressed through artwork. Through reflecting on art together, the process and product, the art therapist can assist the client in gaining mentalization abilities via the therapeutic relationship and the art making process. With the attuned presence of an art therapist, a client can reflect on what they have said, the processes and the products made, and they may see some significance within it for them, and thus be able to verbalize their internal feelings and emotions. Individual therapy allows for a more personal exploration of the more sensitive issues that a client may not feel comfortable exploring around others. Any anxieties a client may have regarding themselves or therapy can be contained and managed in a more one-to-one situation. Some clients may find group settings anxiety-provoking and so prefer one-to-one. individual therapy may initially be more suitable as the client starts to explore their issues. However, after a number of sessions, the client may feel more able and willing to join a group session. Group art therapy offers a client peer support and a shared experience and can allow a person to build their self-confidence and address any social anxieties. In making and sharing art in a group setting, members give and get support from others. Rather than criticising, group members discuss what feelings are evoked when they look at something somebody else has created. The art makers get to see things from a different perspective and are also learning to feel safe and expressing themselves. Group work may also help a person reflect and mentalise upon their internal and external perceptions of self and others. So whether individual or group art therapy is offered within a service, it may depend on space. Not all venues will allow for a group session, so individual therapy may be the only option. However, where a venue allows space for group art therapy, this could be more cost effective for the organisation, but also allow more people to access the service rather than joining what could be a lengthy waiting list. If an art therapist works for a service, and even if they work for themselves, they would usually do an assessment and reports on the client. Assessment is an informative part of the initial art therapy session and is ongoing throughout any future sessions. All communications within a session is informative and part of the assessment. After initial assessments, a post-assessment report will be produced reporting outcomes, recommendations and therapeutic aims. Sometimes during and mid-therapy, assessments are made using questionnaires such as the Strengths and Difficulties questionnaire, will be given for either the client to complete or the child's parent or carer. A review of the initial referral will be made at the end of therapy, and discussions on therapy progress would be helpful, in particular with MDTs or services. Prior to the final report at the end of therapy, a further assessment will be completed and meetings with parents, carers, referring staff and/or MDT will also be held. A final report will be made at the end of therapy with a review of previous therapeutic aims and a note of progress made. Future recommendations and an acknowledgement of the support around the client will be made. All reports are confidential as part of the Data Protection Act and GDPR and the registered bodies. Any artworks made works on multiple unconscious and situational levels and is purely context informed. So its relevance and meaning is to the client and the therapeutic relationship. This may or may not be relevant to the client, but occasionally if an art therapist works with a service, there is usually a team around the client, such as an MDT, which aims to work collaboratively with each person in the team. The work of an art therapist is simply part of one whole. The art therapist has drivers guiding their work from an ethical and professional standards viewpoint, such as the HCPC, the BAAT, NICE guidelines, GDPR, as well as the Children and Families Act 2014, the Children's Act 1989, and Local Safeguarding Children's Board 2020. Within the service, it is advantageous for the art therapist to work collectively with members of the service and or the MDT, and this is to also understand others' professions and their perspectives. It is important that a collective understanding of the client's complex needs are utilised so that the best practice and interventions are considered to fully support the client within the service. This is particularly important if working with children of complex trauma, eating disorders, or more severe mental health issues. The art therapist aims to work with the child or client, parent or carer and other professionals collaboratively so that there is transparency of information to support the client and their needs. So a summary of the services offered. Art therapy offers a client a safe, supportive place to express, explore, reflect on and process sometimes very difficult emotions and feelings. These feelings are safely contained within the therapeutic relationship and the artwork, and this allows a safe distancing for the client to process and understand them. The main points that can be worked through are to bring the client the chance to repair any attachment issues and develop the self through playing and creativity, to get in touch with the unconscious conflict through the art expression and help the client to symbolize it, and also to help the client to develop an internalized concept of the form, content and meaning of the body to integrate them into a coherent relationship. So that's mind and body. Art therapy sessions after assessment are usually 6 to 10 weeks. However, the number of sessions does depend on the individual requirements. Small group sessions of up to 8 may also be provided. And this is also with collaborative working if the client has a team around them as well. And so here are my contact details. And the website yogaandwellness.co.uk for more information and also of the services I offer. As I mentioned at the start, I'm qualified in different areas. Sometimes I use them individually or sometimes as a combination, and it all depends on what the client's requirements are. So if you would like any more information, have a look there, or you can email me at sarah@yogaandwellness.co.uk. So, thank you for listening, and I hope you gained some insight into art therapy. And although this has been about 40 minutes, that is art therapy in brief. But if you have any questions, please do contact me, Sarah at yogaandwellness.co.uk. Bye for now.